Okay, nice to see you again. Now we will continue to take a look at the first type of IBD. The first type is the coldness type. In this type, I'll introduce two formulas. These are very similar. First, let's see the symptom of this type. The IBD patient with coldness type have cold abdomen and worsened stomach ache and or diarrhea after taking cold food. If the patient only have the symptom that I explained above and they do not have any other symptom related to other types, you could classify into the coldness type. In coldness type, increasing diarrhea after taking cold food is the main symptom. Increasing diarrhea after taking cold food can also be shown in respiratory type and upper GI tract type. But as I mentioned above, the coldness type patient has no rhinitis or dyspepsia. So you can easily rule out the other pattern. Coldness type IBD patient has no sign but cold abdomen, so it's easy to distinguish. Personally, I find this type of patients to have most severe symptom when they have diarrhea. For coldness type, I will introduce two proper formulas. First formula is 도화탕, and it consists of these three herbs. First one is 갱미. 갱미 is rice. Yes, it's sticky rice. Some formulas contain food. In ancient Asia, there is a quote, food and the medicine have the same origin. The ancients thought everything we eat is herb. The only difference between food and medicine is the level of efficacy. Next herb is 적석지. It is kaolin. It contains minerals like aluminum silicate. We don't know exactly how it works. These formulas were made 2,000 years ago, and we don't know who started using kaolin, a kind of soil, to treat the bloody diarrhea. And we don't know how it worked. Maybe this question won't be solved. Last herb is 건강. I explained it before. It warms your inside, so stop cold diarrhea. Cold diarrhea means diarrhea after eating cold food. Let's move on to the next slide. As I explained above, the symptoms of coldness type are very, very simple. We can classify into this type if the patient have just cold diarrhea. I said cold diarrhea means diarrhea which happens after taking cold food. Let's think about the case. Sometimes, not always, the patient has abdominal pain and they have no other signs or symptoms such as rhinitis, indigestion. And they don't eat too much because they have more diarrhea when they eat a lot. Hence, if patients have no digestive problem and no water damage sign like swelling and urination issues, it is very simple to be classified, coldness type. But generally, if this type patient have diarrhea, their symptom might be most severe. Whenever they eat something, they have to run to the toilet. Bleeding is also severe. Western medicine does not work. Coldness type would be the most dramatic case. Over 10 times diarrhea is going to 1 to 2 times within a few months. Let's see the next case. In 2021, my ulcerative colitis case report was published. The patient came to my clinic on August 23rd in 2019. He was 31 years old male. He is tall. His body weight is 70 kilograms. He was diagnosed as ulcerative colitis in July 2019. And he was taking Western medicine when he came to my clinic. This is the list of medication he had taken: Asacol, Sorondo, etc. His chief complaint was severe diarrhea. He had diarrhea 15 to 20 times in a day, with bloody mucosal diarrhea. And he also had abdominal pain. He lost his weight about 4 kilograms. He didn't eat cold food due to diarrhea. Fecal calprotectin was over 2,000, which was beyond the measurable range at hospital. And we didn't know the exact point. Normal range of fecal calprotectin is under 50 or 100. Unlikely severe of diarrhea, he had no other sign. This is very important. I could certainly classify him into coldness type. According to the types, I prescribed Tohatang, and after he Tohatang for 6 months, defecation frequency reduced dramatically to 1 time in a day. Abdominal pain, diarrhea, bleeding was eliminated. Fecal calprotectin also dramatically reduced in normal range 8. Let's see the graph. Blue line is defecation frequency. The frequency reduced from 20 to 1. Orange line is fecal calprotectin points. Over 2,000 is down to 8. The treatment ended in January 2020. But due to COVID-19 pandemic, he could not get a colonoscopy. So I couldn't check his colonoscopy after herbal medicine. And the fewer the herb in the formula, the more severe patient symptom. Think about it. The other proper formula of coldness type is 사역탕, which consists of these 3 herbs. First one is 감초. I explained it before. Next one is 건강. I also explained it before. It is used for cold diarrhea. The last one is 부자. 부자 is very important and dangerous herb. In Europe and Asia, they used to poison people. Buja has toxic alkaloid like aconitin, which can kill people. But on the other hand, it's very useful essential herb for pain. Aconitin is turned into aconine, which is safe by thermal hydrolysis. Therefore, you should boil it for over 2 hours for converting from aconitin to aconine. If you use it with proper dose, it will show you powerful effectiveness, especially in warming the cold body and relieving the pain. As I mentioned above, they are quite similar in 2 proper formula, 사역탕, 도화탕. But there are some differences between 2 formulas. The difference is the existence of 부자. 도화탕 has no 부자, 사역탕 has 부자. I said 부자 has the powerful effectiveness in healing the cold body and relieving the pain. So, if the patient has symptoms for which 도화탕 is efficacious and combine very severe coldness and pain, we can use 사역탕 instead of 도화탕. So, when you examine an IBD patient who looks like coldness type, and he complained severe coldness and abdominal pains, combining with severe diarrhea, it would be symptom for which 사역탕 is efficacious. Let's see the next case. In 2020, I published my Crohn's disease case report. The patient came to my clinic on July 5th in 2014. He is 33 years old, male. He is 170 centimeter, 61.5 kilogram. In January, he had severe abdominal pain and was diagnosed with Crohn's disease. He lost his weight 9 kilogram after diagnosis of Crohn's disease. This is the medicine that the patient had taken: Sorondo, Azafrin, Cyasin, Pentasa, etc. These medicines didn't work, and he had severe pain. He was recommended bowel resection. Let's guess his pattern. He was very sensitive to cold. His hands and feet were very cold. He had aphthic ulcer in his mouth for 2 to 3 weeks per month. He had very severe abdominal pain, 4 to 6 times in a day. He had cold abdomen and bloody mucosal diarrhea 3 to 4 times in a day. According to his symptom, we can classify him into coldness type. So I prescribed 사역탕 because he combined severe coldness and pain. We took 사역탕 for 11 months. Sensitive to cold, cold hand and feet, aphthic ulcer, severe abdominal pain, cold abdomen, and bloody mucosal diarrhea are all cured. I ended his treatment. This is the colonoscopy before Herbal treatment. In this picture, you can find longitudinal ulcer. In this picture, longitudinal ulcer, erosion, and bleedings. This is the colonoscopy after treatment. Looks very clear. Let's see another colonoscopy. Looks very clear. No longitudinal ulcer, erosions, and bleedings. Next picture is also clear, right? Let's move on to the last type. The fifth type is large intestine type. In the large intestine type, there are two main symptoms. First, abnormal bowel movement, such as constipation. Fewer than 2 bowel movements per week. Second, the feeling of incomplete bowel emptying with diarrhea. If we have seen enough IBD patients, you can notice some of them have constipation. But constipation of IBD patients is uncommon. What I want to emphasize is the second symptom, the feeling of incomplete bowel emptying with diarrhea. I call it diarrhea, but not diarrhea. In this type, the proper formula is 대승기탕. The proper formula 대승기탕 for large intestine type consists of these 4 herbs. First one is 후박. Hubak is this plant stem peel. It relieved stagnation of qi. It reduced feeling of inflation of chest or abdomen. For abdomen, normally it is gas. For chest, it's not gas. It's just inflated feeling. Sounds strange, but if you carefully check, you can find that symptom occasionally. In IBD patients, the symptom is normally abdominal gas. Next one is 지실. It is small fluid like this picture. It resolves accumulation and relieves distension. This is 대황. 대황 is this plant roots. It dissolves abscesses and nodules and clears the intestine by making diarrhea. Last herb in 대승기탕 is 망초. It is minerals, mainly sodium sulfate. It removes and melts down mass and resolves accumulation. Is there anyone who noticed something strange? 대황 contains cyanide and 망초 is sodium sulfate. These two herbs are used for constipation. We need more explanations. We all know that IBD's main symptom is diarrhea. So, we use formula that stop diarrhea. But now I say herb for constipation. What? Herb of constipation for diarrhea? Am I crazy? Okay, I'll explain it further. If you have a lot of experience of IBD, I'm sure some of the IBD patients have rare constipation, only 1 or 2 times in a week. It's rare constipation, but I want to tell you more about it. Carefully think about the next page. Have you heard about toxic megacolons? Toxic megacolon is malfunction of the large intestine, then makes the abnormal dilatation of colon. Toxic megacolon can be deadly because it puts you at risk for infection throughout the body, shock, and dehydration. Toxic megacolon is a life-threatening condition that needs immediate treatment. Let's see again. If they have diarrhea all the way, why do this happen? IBD patients' main symptom is diarrhea. Toxic megacolon is caused by lack of bowel movement. It does not make sense, is it? Truth is this. Some of the IBD patients do not really have diarrhea. In my experience, 10 to 30%. Of course, they have diarrhea, yes, but it's different from general diarrhea. The patient with large intestine type have diarrhea, but if you ask them proper questions, they will tell you very different answers. The proper question to distinguish the difference are these two. The first is, your stool would be soft and easy to pass every time you need to have bowel movement. The second is about rectal tenesmus. I asked the patient, is a feeling of being unable to empty the large bowl of stool even if there is nothing left to expel? This type of IBD patients, it's hard to pass the stool, like constipation. And they have a feeling of incomplete bowel emptying with diarrhea. So, they take more time to empty their bowl. Maybe everyone in here have experience of weird diarrhea. We need to rush to the restroom, we can't stand it. When it sits in a toilet, it automatically starts. And after that, we feel peace. No more abdominal pain, no more need to rush, just end. That's rare diarrhea. But How about this one? It's different from the diarrhea above. I want to emphasize once again, the IBD patients with large intestine type have diarrhea. It's not constipation, but it's different from general diarrhea. So, for this type, we should give them 대승기탕 to move their bowel. If we do this properly, then remission will be induced. As I mentioned above, symptoms of large intestine type include constipation, diarrhea, which is quite different from a general diarrhea. The patient with diarrhea have two types. One is the patient who had hard to pass. They need to have a bowel movement. The second is the patients with rectal tenesmus. Sometimes they have both 1 and 2. Drugs like antispasmodics and anticholinergic for a long period also worsen this problem. Now, let's move on to the next case. The patient came to my clinic on August 25th in 2014. He was 38 years old male and he was diagnosed with ulcerative colitis in 2007. Let's see his symptoms. He had diarrhea 3 to 12 times in a day and also had bloody mucosal diarrhea. Sometimes he felt the heat, dizziness, and palpitation. He felt dyspepsia, nausea, abdominal pain when he had abdominal distension in lower abdomen. He had rectal tenesmus too. According to his symptoms, I classified him into large intestine type and prescribed 대승기탕. He took 대승기탕 for 16 months. In May 2015, he reduced defecation frequency to 1 to 2 times in a day. No bleeding, no feeling of incomplete bowel emptying. This is his colonoscopy before herbal treatment. You can see spontaneous bleedings here, erosion, loss of vascular markings. This picture also shows bleedings. This is the colonoscopy after he took 대승기탕. It is clear and no bleedings. This picture also shows no bleedings. It's very clear. Anyway, you should be very careful when you prescribe 대승기탕 to the patient with IBD, because their diarrhea will get worse if the patient has general diarrhea. And I'm telling you, it would be bad, seriously bad. And even if you know all the formulas for IBD, treating IBD is always difficult because it is difficult to decide when, what, how much, how long to use her formulas to the patient. You need years of experience to make a decision. And the cases I showed you are simple and easy ones. The patient of the cases have just a single pattern. Easy cases like this are maybe, I think, account for about 20 to 30%. Most of cases are much more complicated. Most patients have multiple patterns, so you should choose the proper formula in succession. If you make one mistake, you will have some situations. For example, a patient has light dyspepsia and light rhinitis and cold abdomen. Which one do you start first? And some patients have other illness besides IBD. You should consider it with IBD. And some patients complain side effect of Western medicine, like moon phase of Cushing syndrome. What should we do? And it's true. You are what you eat. So, what exactly can make IBD worse? In my experience, first, alcohol. You have to strictly forbid it from now and never. The second, antibiotics. Except real necessity, you should forbid it as well. Third, all instant food that include preservatives and chemicals should also be forbidden. Fourth, spicy food, because it is irritating your bowel and should be avoided. Hence, all this food influence the outcome. I want to show you this paper, titled Association of Ultra-Processed Food Intake with Risk of Inflammatory Bowel Disease. It says higher intake of ultra-processed food was associated with a higher risk of incidence of IBD. Compare the group with below 1 servings a day. Hazard ratio was 1.82 in the group with above 5 servings in a day, and the ratio was 1.67 in the group with 1 to 4 servings in a day. Hence, higher intake of ultra-processed food was positively associated with risk of IBD. We reviewed briefly about Korean herb medicine for IBD. I can't show you all. Time is too short. There are more formulas to use for IBD. If you are interested, you can find more information about in my paper. Now, I found some more formulas and I'm trying to find new formulas for treating IBD. Treatment of IBD is long and hard work, but we can do it. Many of my patients have overcome it, maintaining remission for years without Western medicine. Lastly, but not least, I will continue my studies in IBD and keep reporting the cases to perfect the treatment of IBD. This is my email. If you have something to ask me, feel free to email to me. Thank you for listening and being here. Thank you.